Welcome back. Today we're talking sickle cell disease. Sickle cell is a form of anemia that impacts more African Americans than any other ethnicity.
So here to discuss this is Dr. Felicia Robertson, a physician with Aurora Health Care. And this week you had Awareness Day on this, so it gets this to people's attention. What is sickle cell disease or anemia?
So sickle cell disease is an inherited group of red blood cell disorders. And specifically, it's when the genetic component of the hemoglobin becomes sticky and rod-shaped and sickle-shaped, in fact.
Okay.
The normal red blood cell is going to be oval-shaped, easily going through all of our red blood cells. And this genetic abnormality causes a myriad of symptoms and complications.
Like what? Like, so people who have sickle cell, what do they deal with on a daily basis?
Sure, and because it's genetic, and babies are born with it, much like they get the genes of eye color, hair color, etc. And usually by 5 months of age, babies will present with symptoms of anemia, which can be fussiness. It can be they're very fatigued, they don't want to eat, their growth may be affected. They can have their own pain crisis to where their fingers and feet can be swollen, as well as jaundice, yellowing of the eyes and skin.
Yeah, I was trying to see if we were going to list some of those, but there are some myths attached to it as well. Sickle cell?
Okay.
Okay, well, I just wanted to make sure there was something about that. But what is it that you want people to know? Do most parents know about this before a child is born?
So individuals who are of reproductive age and they want to have babies, a lot of individuals don't know their own sickle cell status. So, and what I think might be one of the myths that you're talking about is a lot of individuals, while it affects 100,000 African Americans in America, it affects millions of individuals worldwide, to include beyond Africa and the Caribbean areas. It affects folks of descendants from Greece and Italy and India and Turkey, South and Central America as well.
So how do you diagnose it? How should people, if they're watching at home and some of those symptoms seem like the babies are having it, how do you go about getting a diagnosis?
So the great news for infants in America, every state does newborn testing. So parents, as long as they stay in communication with the hospital and they have a valid address, they should know about the baby's status that has sickle cell disease.
Perfect.
Yes.
Perfect. All right. Well, thank you so much for joining us. And if you have a question for our experts, you can email them at asktheexpert@todaystmj4.com. You can also leave a voicemail. That number is right there on your screen.